And joining me now is the U.S. Surgeon General. It's Vice Admiral Jerome Adams. Admiral Adams, welcome to Meet the Press. And let me start with, you're the Surgeon General. Give us your recommendation on face masks.
Well, it's important for America to understand that originally the CDC, the World Health Organization, and my office all recommended against the public wearing face masks because the best available evidence at the time suggested that they were not impactful in preventing you from catching a disease if you were the individual wearer and you were healthy. We always recommended that if people had symptoms that they wear a face mask to prevent spreading disease to other folks. Here's what's changed. We now know that about 25%, in some studies even more, of COVID-19 is transmitted when you are asymptomatic or pre-symptomatic. And so the CDC has now recommended that people wear cloth face coverings when they're going to be out in public and they can't be more than 6 feet away from each other. But here are the important points really quickly. Number one, you need to make sure you're not substituting social distancing with face masks, because the most important thing is still to stay away from people. Make sure if you put on a face mask, you don't touch your face and you wash your hands before you utilize it. And number three, save the medical mask for the healthcare workers. Excuse me, they need them. They absolutely need them to be able to respond. I have a video out where I made a cloth face mask out of a t-shirt and rubber bands. Anyone can do this. We all need to do our part to get through this.
I'm curious, I know you made the warning, you're saying you don't want people to make a run on clinical or surgical masks. Two questions I have on that front. Number one, if you are caring for somebody in the vulnerable age group, should that person be wearing a surgical mask? And second, if there were enough around the country, would that be the recommendation? And is it the only reason we're saying do homemade ones is we just don't have enough masks?
Well, the reason why we're saying make a homemade one is because that's effective in protecting you from me. Remember, I'm wearing a mask to protect you, Chuck, and you're wearing a mask to protect me. That is what you need. We want to make sure we're saving the medical mask for the healthcare workers, and we still wouldn't recommend that people wear an N95 even if we had enough. When I'm in the hospital, I have to get specially fit tested to wear an N95. They're uncomfortable and you can frequently touch your face. If you're taking care of a loved one who is either older or has medical conditions, very important you wash your hands frequently. You do everything possible to prevent spreading disease to them. And I would encourage folks to consider wearing a cloth face covering when you're within 6 feet of that person so that your droplets aren't going to them and you're not potentially spreading disease.
The president made it pretty clear he's not going to wear one. Would you recommend people wearing one at work?
That again. So here's what you have to know. If you go to the CDC website, it says, number one, this is voluntary. We're asking people to think about doing it to protect their neighbors and their family. But number two, it's not a substitute for social distancing. If you're at work and you're 6 feet away from someone, there is a minimal chance that you're going to spread disease. If you're in a work environment where you're within 6 feet, where you're really close to someone, that's definitely something to consider. And again, that's what the CDC guidelines actually say. They're based on the science. We always try to evolve our recommendations based on the best available science.
Admiral, I know you're hesitant to backseat drive other officials in the calls that they have to make, and I'm very aware of that. But I am curious, if you were advising the 9 governors who have not issued stay-at-home orders, what would you advise them to do?
Well, I would advise them to follow our 30 days to slow the spread guidelines. I ran a state department of health. I've talked to many of these governors, and here's what I say to them. Here's what I would say to them right now. The next week is going to be our Pearl Harbor moment. It's going to be our 9/11 moment. It's going to be the hardest moment for many Americans in their entire lives. And we really need to understand that if we want to flatten that curve and get through to the other side, everyone needs to do their part. 90% of Americans are doing their part, even in the states where they haven't had a shelter in place. But if you can't give us 30 days, governors, give us a week. Give us what you can so that we don't overwhelm our healthcare systems over this next week. And then let's reassess at that point. We want everyone to understand you've got to be Rosie the Riveter. You've got to do your part.
It sounds like at a minimum you'd wish every governor would issue at least 1 week.
I wish every governor would encourage the people in their states to follow these guidelines for 30 days. That's what I want, but I want them to do what they can within their states. We know that from a public health perspective, and I ran a public health department, whether it's smoking or opioids, there are all sorts of different rules and regulations in different states.
Right.
You remember just last week, which was forever ago in Corona time, Governor Cuomo actually said it would be declaring war on the states to issue a federal quarantine. Governors are rightly protective of their ability to determine what's best for their citizens. We want them to have the science to make the best recommendations.
I want to put up a quote from Amy Acton. She is the Director of Public Health in Ohio. She said this on March 13th. And Admiral, it has been haunting me ever since. And this is what she said. On the front end of a pandemic, you look a little bit like an alarmist. You look a little bit like a Chicken Little. The sky is falling. And on the back end of a pandemic, you didn't do enough. Are those words that we should all be living by, which is, you may be hesitant right now if you're a leader about debating health versus the economy. Hindsight, you're going to wish you had done more?
20 years in public health, and I know Director Acton, those words couldn't be truer. We are always telling people we would rather prevent disease than treat disease. I tell people we aren't going to treat or supply our way out of this problem. There is no magic bullet or magic cure. It's good old-fashioned public health and prevention, everyone coming together, practicing good hygiene, staying at home, doing the things that we've always told people to do to prevent spread of infectious disease.
When are we going to have a website like was advertised a couple weeks ago where we can get a test, where we can find out about these antibodies? Because it seems clear we're never reopening this economy fully until we're able to GPS this virus. Where are we in testing, sir?
1.6 million tests, and you mentioned that. That's about 1 in 200 Americans. That's where South Korea was with their initial testing surge. We're seeing testing ramp up, particularly with the Abbott rapid test. And we know that it's never enough test fast enough, but I feel confident that within the next 2 to 4 weeks, we're going to be where we want to be able to do adequate surveillance and understand where the disease is, where it's high and low, and and to have appropriate public health recommendations. But what does reopening look like? We want to make sure we're seeing cases go down for a good 1 to 2 weeks in places. We want to make sure we've got testing, but we want to make sure we've got good public health infrastructure so that when we identify a positive test, people can then follow up, isolate, follow up on their case contacts, and make sure a single case doesn't turn into 10, 100, 1,000 cases.
Do you think by the end of April we'll be in a testing situation where we're actually doing surveillance rather than just trying to play catch up?
We are doing surveillance in many places. Montana, for instance, actually has a higher testing rate than the average for the rest of the country. So we're doing surveillance in many places. We're going to get the antibody testing out there, which is going to give us more information. And I talked to Admiral Giroir, who's the head of the testing task force. He said he feels within a month we'll have antibody testing more widely available. Again, 100,000 tests being done per day, 50,000 Abbott tests coming online. America testing is becoming more and more available, but it still doesn't replace the fact that we want everyone to act as if they have COVID-19 right now and protect your neighbor, protect your loved ones.
Very quickly, Admiral, the president mused about a one-day reprieve for Easter Sunday. I understand it from a hopeful scenario. Would that be a public health mistake?
The president is always hopeful, he's aspirational, and we're trying to give people the science. The science says that right now, this Palm Sunday, and I'm a Catholic, I would ordinarily be getting ready for church right now, we need you to stay at home. This is going to be a hard week, it's going to test our resolve, it's going to be the hardest week of our lives, but I'm confident based on the numbers in Washington and in California and Italy and in Spain, we can get through this, we will get through this. I know the American people will do the right thing and stay at home.
Surgeon General Jerome Adams, thanks very much. Stay healthy, stay clean, and I hope people do watch your video on how to make a mask. Thanks for coming on and
watch
sharing
it.
Your perspective.
Stay home. If you go out, use one of these. Thank you, Chuck.
All right. Thank you, sir. Hello from Washington. I'm Chuck Todd, and thanks for checking out the Meet the Press channel on YouTube. Click on the button down here to subscribe and click over here to watch the latest interviews, highlights, and other digital exclusives.